everybody. Come on in. Come on in. Hi, YouTube. Hi, Facebook. We are here and we are going to get started with our anxiety workshop. My name is Regina Callion. I will be your host and just a giver of information today. The goal of this workshop will be for us to look at anxiety, look how it can affect our lives, and also to think about some practical things that are happening in our bodies and how we are able to kind of change our thinking. Now, I have to give a disclaimer to everyone. The things that we talk about should not supersede any medical advice that you already have from a professional. The medications that we go over, you definitely need to talk to a healthcare professional if you're interested in taking these medications. If you've never been to a REMAR review event, welcome. But I want to let you know that REMAR nurses, we are a community. We're actually a community of nursing students, professional nurses who all come together, and we encourage and we motivate each other to get the license. We motivate each other to get the right perspective, to try again. It's just a very encouraging community. So I am very excited that you are here for the first time, and welcome to all of my REMAR nurses who have been to many, many of our events. Do you hear the music playing? It's to get you. It is to get you in a state where you're like, okay, I can do this. Hey, you definitely have to have your workbook if you are going to participate fully in this class. This will be very important. Also, you'll want to have a box of crayons. You want to have a box of crayons actually because we're going to color some things in, and we're going to make it a little bit more hands-on and practical this workshop, okay? So I'm happy that you guys are all here. Come on in. Come on in. Do you have your workbook? Do you have your workbook? Do you have your workbook? You need to have it, okay? And this has been with me for the last couple of days. I've been just taking it with me. I took it out of town with me. I've just been working on it. So I'm happy to share the information with you guys. Okay, so let us get started again. This is our anxiety workshop. We're calling it Be Anxious for Nothing. And it is perfect for nursing students who are preparing for exams at any level, and also professional nurses. If you find yourself working, if you find yourself in a nursing environment and you're having anxiety that you did not have before, this is going to be very beneficial to you, very beneficial to you. So this is what it is. All right. So if you turn the first page over, it's a welcome for me. And it just tells you kind of how anxiety is normal. It is normal. So we're going to fill out the blanks. If you're on Facebook, you will be able to see the slides and fill it out. If you're not on Facebook, if you're on YouTube and you're following me, I will read you the things that you should be filling out. But your workbook comes and there's blanks so that you can actually input the information, and it will help you. It will help you. So let's start with what anxiety is. Anxiety here, as we know it, is an intense, like this. Anxiety is an intense emotional state. It is an intense emotional state. And it's interesting because, when people have anxiety, it presents to them in different ways. So here are some words that describe anxiety, and you can kind of say, yes, I have this, or no, I don't have this. But people call anxiety stress. They say they're stressed out. People call it edginess, nervousness. Some people experience anxiety as a freaking out, worry. People get butterflies in their stomachs, agitation, fear. All these descriptors qualify as anxiety. All these descriptors qualify as you having some form of anxiety. So our first activity, we're going to get right into it. Our first activity is this here. It's actually a picture of a man or a woman, I guess. But what I want us to do right away is I want you to get out your picture. This is the second page. And if you have your crayons, if you don't have your crayons, you can try to do it with a pen and maybe come back later. But if you have your crayons, I just want you to, on your man, draw the areas of your body that you feel anxiety at. And I know this may seem like, oh, why does she have us doing it? But it is very important, because when you experience anxiety, there are real physical symptoms that go along with it. Now, if you're experiencing anxiety, but you don't feel like it's affecting you at all, it may not be anxiety. It may not be anxiety. So I want you to take a second to do it. And I'm going to kind of direct you. I'm going to kind of direct you to, oh, thank you, Mark. Thank you. So that's the picture. Cool. All right. So if you have a brown crayon, you can draw hair on the guy. You want to do it? If you have a brown crayon, do you want me to? Mark is going to do it. Yeah. Cool. I'll do it. Okay. Thank you. So you guys can, I don't know if Facebook can see me. Facebook may not be able to see me. Okay. So if you have anxiety and it affects your hair, you can draw hair on this person. And one of the things about anxiety is maybe you don't know if anxiety affects your hair, but what you will notice is that your hair won't grow, or it will be very brittle and break off. When I was in nursing school, my hair was like 1 inch long the entire time I was in nursing school. And I never thought that it could have been anxiety that was keeping my hair from growing, but it just did not grow. So anxiety can affect your hair. Anxiety, and you guys think about this, anxiety can also affect your heart. So if you have a red crayon, go ahead and draw a heart on this person. Can anybody think of how anxiety affects the heart? How it affects the heart? Some people may be able to say, anxiety, when you're anxious, it actually does cause your blood pressure to go up and your heart rate to go up. So you can feel it. You'll have palpitations, and anxiety definitely affects the cardiovascular system a lot. Yes, blood pressure and heart. Exactly. Okay, let's move on. If you have a green crayon, you can draw a little stomach in your person, because anxiety will affect your GI tract, your gastrointestinal system. It also really affects the stomach. But people with anxiety, when they say they have butterflies in their stomach, actually what they will experience are cycles of constipation, then diarrhea, and it is very common for that to happen. Okay. Another common thing that anxiety affects, we're talking about how anxiety affects our body and the things that we feel. Yes, absolutely. You can feel chest tightness when you have anxiety. But as far as the stomach goes, yes, you have the butterflies in the stomach, the cycles of constipation and diarrhea. I wanted to put a little X in the genital area, because anxiety will affect your reproductive system a lot. Anxiety will affect the reproductive system a lot. For women, it will decrease libido. It will cause problems with fertility, and it will also bring about PMS or PMS symptoms actually for women. And for men, they can have problems with, of course, the decreased libido and also like erectile dysfunction. So it plays all over the body. Everybody presents with different symptoms. Take that red crayon if you have it. And also put X's on the knees and also on the elbows, because anxiety will cause joint pain and inflammation. So it also causes that. And I didn't realize how much anxiety can affect your body. So these are just some of the, let me get back at my thing. These are just some of the common symptoms of, anxiety. And some of you guys may be anxious right now and you feel it in your body. Thank you. All right. So how real is anxiety? How real is anxiety? It is very real and it is very common. I was not surprised at this, but the statistic that I saw said that anxiety affects women 2 to 1 compared to men. So it is very common in the female community for us to be anxious, and it is considered like a mental disorder. But what is more impactful, I think, is that people compare anxiety to chronic illnesses in terms of how it decreases your quality of life. So people say that living with anxiety is like living with type 2 diabetes mellitus, because you just have that poor experiences throughout your life. I mean, like every day. So think about this. Everybody, you're agreeing with me. YouTube is agreeing with me. Yes, this is very common. So we're going to look at it some more. But yeah, interesting. It says that anxiety here, in my notes, is anxiety here is more common than actual depression. So more people are anxious than they are depressed, but we hear so much about depression, but not as much about anxiety. And I wonder why. Do we not take it serious? Do we not take it serious? Anxiety can be caused by many things. Anxiety can be caused by many things. So you're filling out page 2 of your workbook. Okay, page 2. And for everybody that's testing, just come on in and just sit with us and learn. Sit with us and learn. Anxiety can be caused by many things. Some of the things in your workbook that causes anxiety, of course, exams and tests, deadlines, job interviews. As new nurses, as working nurses, you have to be prepared to sit in front of people and talk about yourself. Yeah, and talk about your goals. And that causes anxiety in some people. As nurses, we don't always like to focus on ourselves. It's easier to talk about other people. Waiting for babies to be born can cause anxiety. If a loved one is in an accident and you're waiting to know the status of that loved one, that can also cause anxiety for us. And then getting bad news or losing a job. These are all things that can cause us to be anxious. But you know what? Anxiety, normal anxiety, should I say, because there is a purpose for anxiety. It does have a reason why we experience. And normal anxiety, though, is adaptive, and it increases based on the situation. So it is adaptive. And what I wanted to elaborate with that is that 2 people can experience anxiety totally different. kind of like how your NCLEX exam is tailored specifically to you, anxiety is tailored specifically to you. You have your own measure of anxiety that your body dishes out for you based on the situation. So I thought it was helpful. When you think about anxiety, it performs in a certain way. Now, this is just normal anxiety. But if you think about anxiety where it's the actual condition and you should be seeking medical treatment, well, I have the note here, pathologic anxiety, all right, is excessive and it impairs function where you have it for more than 3 or 4 weeks. You just are constantly anxious. So kind of think about what kind of anxiety you may be feeling. Is your anxiety based on a situation like a test state, or is your anxiety all encompassing? So every decision that you make, you feel the palpitations, you feel the nausea, you feel the apprehension, because one is okay to have and the other one you may want to seek some additional help. Okay. So it's very common in nursing. It is very common in nursing. Actually, 70% of nurses say that they experience anxiety in the workforce. So as those interested in going in the nursing field, you can expect to be in some situations where the natural response of anxiety kicks in. When I think back over my life, I did not know what true anxiety was until I got to nursing school. Like, I didn't have anxiety in the same way, but when I got to nursing school, I started to experience this anxiety to where it was very difficult for me to, just deal. It was very difficult for me to deal, like, if I can be honest. And I think this is one of the reasons why I wanted to do this workshop, is because nobody told me in nursing school the strain that it would put on my life and the amount of information I would be expected to know in such a short period of time. So it was very overwhelming. I experienced anxiety in nursing school in a big way. And there was no resources that were presented to first year nursing students to cope with the transition. And so I found myself studying for an exam, and then all of a sudden the back of my neck was hurting and my mind was, cloudy. And I just thought, like, wow, is it me, or is this room getting smaller and smaller? Have you guys ever experienced that? Like, yeah, the room gets smaller and it's like, what's going on? And it's just, you're just anxious. Your body is anxious. So there are four ways that you experience anxiety, 4 factors that determine if anxiety will be an issue for you and how you will interpret this experience, right? So the first one is genetics, which I learned. How your parents handled anxiety or experienced anxiety will flow down to you. It will flow down to you. So we have to consider that anxiety can definitely be environmental. If your parents were always stressed and, worried, it does affect the children. The second thing is brain chemistry. Well, when you're anxious, your brain definitely sends off hormones and neurotransmitters to get the body ready to move, right? Because anxiety tells you that you are in a situation that you need to get out of. Also, life events, of course, things that happened in the past to you will contribute to whether you are anxious or worried all the time. And then, of course, your personality. just who you are as a person will determine how you interpret the things of life that come your way. These things contribute to whether a person is a warrior or a warrior. Did you like that? Whether you're a warrior or a warrior. And that's kind of what I want us all to move from one place to the next. Now, we don't have control over the genetics. We don't have control over the brain chemistry or the past. These are things that we cannot control. So it's no sense of us trying to harp on, oh, our grandmother did this, or our dad, did this. We can't control those things, but we can control the fourth cause, which was personality. And personality, a lot of it is how you choose to look at a situation. So when we go into this, there are some natural benefits of anxiety. Okay. There are some natural benefits of anxiety. The first benefit here, and you guys are filling out your worksheet, anxiety, it encourages you to be more aware of your environment. Yeah. Anxiety encourages you to be more aware of what is going on. It also alerts you to danger. It is a natural response in your body to protect itself. Yep. And anxiety causes your brain to think, okay, this person needs more of certain hormones, okay, that will produce a reaction in the body. So these are the natural benefits of anxiety. We should understand that it is normal. There's nothing wrong with having it. It's how we interpret what's happening. So the chemistry, you guys know, the chemistry of anxiety is the fight or flight, right? It is the fight or flight. That's what happens when you experience anxiety. Now, I know you guys know this, so I just want you to tell me it right now. The changes that happen when we're talking about fight or flight, this is like NCLEX style question, NCLEX prep right here, this little section. I want you to tell me if it increases or decreases during fight or flight. That's it. Increases or decreases. So the first thing is the heart rate. During flight or fight, does the heart rate increase or decrease? Increases. YouTube got that one first. Increases. Okay. How about the blood sugar? Does the blood sugar increase or decrease? Blood sugar increase or decrease during fight or flight? What do you guys think? Definitely everybody should have increase. Yes, increase. What about the immune system? Does the immune system increase or does it decrease during flight or fight? Do you need to be more healthy? Does the immune system like say, hey, I have the priority? What do you think? Increase or decrease the immune system? I haven't seen the right answer yet. The immune system definitely decreases. Yes, good job, Keisha. The immune system will decrease. Digestion also decreases. I know you guys know digestion will decrease. Blood pressure goes up. Blood pressure goes up. I'm just going to tell you guys these last couple ones because I know you guys know these ones. So the blood pressure goes up. The pulse will also increase. And you can fill out the chart here. The pulse will also increase. And temperature increases as well. Temperature increases. And the pupils will also dilate. Okay? The pupils will also dilate. So this is the fight or flight. This is the fight or flight response here, and this is what your body does. And here's the crazy thing about it. This is what your body does to itself every time that you get anxious about anything. This is what happens in your body. Isn't that a lot? Like, I don't think we realize all the things that happen in our body. So how much should we be aware that anxiety starts in the brain, and then the brain signals everything else? So how we choose to look at situations will cause our body to not go through all these changes, just saying it very plainly. Another thing that happens is that adrenaline, when we talk about a chemical, and this is very insightful, adrenaline is released every time that you are anxious. And the purpose of it is to, the body, when adrenaline is released, I'll just read the slide. When the adrenaline is released, the body immediately becomes stronger and faster. Because remember, anxiety is supposed to move you out of a situation. So the body says, okay, this is an issue. Usually the example people give is like if a bear is coming to attack you. If you're in the woods and you're camping and a bear comes out, you need that fight or flight so that you could be faster than you normally are to get away from the bear. So this is what the body expects. The body expects that if you're anxious, then you're anxious for a reason, that you're in danger of some sort, and I am going to give you what you need to get out of danger, but in return, you have to flight, okay, or fight. That means you have to do some physical exertion. It says at this time, when that fight or flight is happening, the body needs physical exertion to take away the adrenaline. It needs physical exertion to help it get back to a normal state. That should be the cycle. If I'm anxious, then I need to run away. I need to do some form of activity. But the problem is that when we're anxious, and if it's before an exam, the body says, okay, you're telling me that you're anxious, so I'm giving you the adrenaline. I am decreasing the parasympathetic nervous system. I'm increasing the sympathetic so you can go, but we don't go anywhere. We're like in the library hanging out, and all these things are happening in our body, and we're just like sitting there, just stressed, and the hormones are going through our body, and we don't keep up our end of the bargain. And so it puts a lot of wear and tear on our insides because we haven't done what we naturally should be doing. Does that make sense? Yeah. So let's look at another activity, or drinking too much coffee. I like that. You can get the worksheet. If you don't have the worksheet, you can download it from a link here or on the website. So on the next activity that you have, let's do another one. The first one we looked at where anxiety affects the body. Now we're going to look at, let's just do it. So on your sheet, you have a blank square, right? Everybody's looking at it. Hey, Mark, can you give me that again, please? Thank you. So on your sheet on page number, what page is it? Page number 4, there is a blank sheet of paper. Yeah, you can put that there. There's a blank sheet of paper, okay? We're all looking at this blank sheet of paper here. And we are going to pretend that it's the first thing in the morning, and we are standing at our bedroom door, okay? We are standing at our bedroom door, and we're looking out of our bedroom door. In the box, I want us to write down all the challenges that you might be faced with that will make you experience some anxiety, okay? So you're in the first thing in the morning. What are some things that you think about that causes you to be anxious? I'm going to give you some time to think about that. Let me put on the music. I'm going to do some just a little calming music so we can think about it. Just write down some things that cause you. They're asking for the worksheets on YouTube too. Just some things that you are faced with. Let me give you some examples of some things that I have here. First thing, one of the first things I think about is eating the right foods. Like, what am I going to eat for the day? I have being late for work, right? Assignments in school. Somebody said when they wake up, they're already late for work. Being late for work. I like that. NCLEX. Absolutely. NCLEX. How about not having enough time? Not having enough time in the day for things that are important to you, like your kids or your relationships. So we're standing at our bedroom door and we're writing all the challenges that we are confronted with. Yes. Tina says no money. Yeah. Write all the challenges that you're confronted with that will cause your body to feel stress, feel anxious. There are many. I know there are going to be many. Yeah. Your relationship with God, being focused. We probably could fill up this whole box of things. If you're in nursing school, clinical exams or your care plan. Yes. The things you didn't do yesterday. I like that. The house not being clean. How many things can we have on here? Finding a babysitter. I hear you. I hear you. Mm-hmm. Yeah. Your house, the bills, not having enough money. Yes, I like that. Staying focused. So we're just writing all the things. We're writing all the things that can stand in our way, that can cause us to feel anxious, right? Now, there's a category. There's categories on the next page. And I want us to finish up our list. Write the last things down on your list of things that you face on a daily basis that cause you to have challenges. Being a good mother, being a good spouse, relatives, yes. Dealing with relatives, I don't speak to that. Traffic and driving. Let's finish up our list. Yeah, we don't have a lot of time. It is very difficult. Time is very, very, you feel it. Time puts a lot of pressure on us. Past failures. Yeah, past failures. Now, on real and imagined. And these are the categories of your stressors. Are they internal? Are they coming from you? Real things, or are they imagined things that you're worried about that may or may not ever happen? You're just imagining them. So let's try to categorize some of our stressors that we had down. So I took some notes of some of the things that you said. So here we go. I like this one. All right. So NCLEX. Stressing about NCLEX. Would that go in internal, external, real, or imagined? What do you guys think for NCLEX? I think the NCLEX exam is, what do you guys say? You guys are laughing. I think the NCLEX exam is definitely a real stressor. That is an exam that you have to take, and it is, it carries a lot of weight because it determines whether or not you get a license. And I think you can really put any test that you have to take, whether it's your entrance exams when it comes to nursing, your final exams, NCLEX, if you want to go progressive care nursing, whatever, these are very real stressors. What about another one? Not having enough money. Not having enough money. Is that internal, external, real, or imagined? This one's kind of tricky. And it may actually fit into a couple of categories here. I think sometimes not having enough money can be external because there are things outside that are causing you to, look at a budget and say, I don't have enough money for this. I want to do this, but I don't have enough money. So I think money can be an external stressor based off of what kind of lifestyle that you want to live or you desire to have. And also it could be real. So external and real. Somebody said not having enough time. Not having enough time. Not having enough time. To me, not having enough time is almost imagined, because I find that when we prioritize the things that are most important, the time stressor decreases. So sometimes I feel like I don't have enough time for my kids. Like when I get up in the morning, I have so many, you guys know how busy it is at Remar sometimes. And I feel like sometimes I don't have enough time for my kids. But I know that when something has to be done, I'm able to set aside certain things so that I can accomplish what I need to do as a mother. And I think it's true for everybody. Not having enough time sometimes is because we're trying to meet the demands of other things or other people, as opposed to putting ourselves first and sacrificing. So I think sometimes time can be imagined. What are somebody saying? Distractions. Okay, I think distractions would be external unless it's your own thoughts. Like if you're a procrastinator. If you're a procrastinator and you woke up at the last minute, or you're late for work, or you're late for class, that's an internal stressor, because there are things that you need to do in order to reduce the stress of rushing to get ready. So we're categorizing our list of stressors. We're categorizing our list of stressors to see exactly where are they coming from. What is influencing us to put this stress on our body almost every day? How about your job? What do you guys think for your job? Internal, external, real, or imagined? Because some of us, we struggle getting up and going to work every day. It is a stressor to go to our jobs. What would you say for your job? Job equals what? I think your job can be real. I think your job can be very, very real. It can be a real stressor. So real stressors mean that sometimes there are legitimate reasons why you're anxious and your body is sending out these hormones and, these fight or flight situations. Because your job, I like that, real and external. Because especially when you're a nurse, sometimes your job can put you into some crazy situations and some almost dangerous situations. So your job can be a stressor. If your job is a stressor, I encourage you, don't get stuck in a place where you're constantly stressed and you are unhappy. All right. So we've been categorizing our stressors. And let me say something about stress. I found these statistics that I think are really interesting. Okay, I like that. Monica asked, health. What about your health? Being stressed about your health. I absolutely think that your health is an internal stressor, honestly. And I'll tell you why I think if you have a health condition, it's an internal stressor, because there is absolutely nobody else who is responsible for your health but you. You cannot depend on your doctor. You cannot depend on your nurse, nobody else. So you have to take responsibility for the things that you do to your body or the things that you don't do to your body. Because, one thing about health is it's something that you cannot buy. You only get, one spine. You only get one back. So as a nurse, we don't take care of our backs, and they go out, they go bad, they start needing surgery. There's nothing that can be done. And so every day when you're thinking about, how is the condition of your health, you have to assess, am I doing things that are reducing the stress on my body? Am I eating things that are reducing the stress? So that's kind of how I look at your health. Your health is so important. But these are the statistics that I found out, and you guys can let me know if you agree with them. 40% of the things we worry about never happen. They're all imagined. They're not real. They're not going to happen. For example, we worry about getting the NCLEX. We worry about, going for NCLEX and not remembering anything at all. And it's something that we worry about the whole time we study. Sometimes people, they email me and they say right away, Regina, I brought the DVD package, and I'm just scared that I won't remember any of this stuff. And it's like, already in the beginning of studying, you're afraid you won't remember anything. You have to stop it. You have to stop that, because it will carry throughout your whole studying process. Okay, Denise she's question mark, violence in the community. Violence in the community is external. It's external. And some things about external stressors are, they're not things that you can control. So we worry about it, we stress about it. And actually, this is one of my other, let me do my statistics. 40% of the things we worry about never happen. 30% are in the past and cannot be helped. Okay. So 30% of the things that we worry about are past failures, right? We failed in the past. We didn't get into the job that we wanted, and we're stuck at another job, but we're still thinking about it. 12% of the things we worry about involve the affairs of other people and are not our business. Okay. 10% relate to sickness, whether it's real or imagined. And then it says here, only 8% of the things that we worry about actually happen. Only 8% of the things that we worry about actually happen. So we really have to think about, what is the benefit? What is the purpose of stress? Okay, think about the natural function of it, which is to create flight or fight, all right, to move you out of the situation that you're in. And then what are we applying it for? What are we applying it for? So in the instance of things that are happening in the community, police brutality, violence, death, and shooting, what are the proactive, positive things that you can do as opposed to just being anxious about it all the time? What are some positive things that you can do? Because remember I said, when you experience anxiety, the body gives you what you need to protect yourself, but it also is expecting you to perform some kind of physical activity, to perform some kind of physical exertion to get your body out of the anxious mode. So if you're looking at these things that you have listed that are common stressors in your life, do you respond to any of these stressors by doing physical activity? We talk about not having enough money, hating our job, not having enough time. We get the body going, saying, hey, this is a situation. Do we do any exercise? Are we out running around? Are we out, balancing the community? Are we anxious about it? So we go door to door. Like, how is it really affecting our health? And long term, are we going to be able to keep up this pattern? One of the things about this workshop that I wanted us to do is to be able to identify the stressors in our lives so that we can determine if we want to keep going on in this way. And so for me, as I was preparing for this, I noticed a lot of things that I got worked up about that honestly were out of my control. Okay. Honestly, were out of my control. Or I could think about how I can think about it differently. So here are some realistic ways. Here are some realistic ways that things that you could do to release the buildup of stress in your life. Reduce the buildup of stress in your life. And you guys may also have some suggestions of things that you can do to not get yourself worked up over these things. So, of course, the first thing is going to be exercising. When you first wake up in the morning, there's two ways to stimulate your metabolism, stimulate your body. You can eat or you can exercise. Most of us, I believe, wake up and we eat. And that's what gets the body going. That's what signals the body that it's time to go. Some people, you wake up and you find that you're feeling stressed or anxious. It would be great for you to try to do some sort of exercise, and not even a long 30-minute, run or anything like that. 10 minutes. Do a 10-minute stretch. 10-minute stretch. Do marching in place. Just something that will help the body relieve tension and signal your brain that it's time to get moving, but in a positive way. Okay? I'm not going to even say that. All right. So, okay, prayer, meditation. Prayer and meditation too. All right. You got to be confident. Absolutely. All right. It's time for activity number 3. Okay. Activity number 3. And the title of this activity is called Peace Within You. Peace within you. Some people think that you have to go out looking for peace. You get it if you're in this location. You get it if you do these things early in the morning. But actually, peace starts within you. So I want us to just get ready for this activity. Let's start. Let's take a couple of deep breaths. Okay. Deep breathing is good. And if you look at the activity, what you have is a blank page with clouds on it. I want you to take a blue crayon and just color the clouds blue. All right. And, I'm going to do it too. The clouds are really actually for this picture. When you look at this picture, these clouds represent peace for you. Every day that you wake up, you are given a clean slate. Okay. You're given a clean slate of how you want that day to go, what you want it to look like, And you start off with portion of peace. You woke up this morning, right? You woke up in your right mind. I think we can all be grateful for that. Coloring also, I wanted to do this because coloring relaxes the brain. And we do it all the time when we're little. It's mandatory that you do it when you're little. But when we get older, we get out of it. And we get more into technology and computers and things like that, which stimulate the brain. But coloring for adults has been found to relax the brain. It helps you to focus on one thing, which will reduce your anxiety. So at the end of it, my clouds are blue, and this represents the peace that I have every morning. And this is the same peace that you have every morning. So when you look at it, it's like, yes, this is for me. Okay, this is for me. Now, take your red crayon and write down over the clouds the things that are your stressors. Okay, the things that are your stressors. So whether it is time, just write it over the clouds. All right, take a red crayon, write it over the clouds. NCLEX. We said what? No money. We said no money. What else? What is it? Our health. I guess bad health, what we say. Yeah. Bad health. Past failures. If you failed an exam in the past, we think about it. So actually, this is what we do. If you see it, we take the peace that we have every morning, and just as we wrote down, when we look out outside of our bedroom door, and we cover the peace up with these things. And so, we try to go out and find the peace again, but it really starts with us. This is what we do, right? This is what we do every day. Yes, you can put so many things on top of this. I like that. When you don't sleep enough, when you don't drink enough water, these are all things that affect you mentally, your priorities, your time management. But this is a visualization of what is actually happening. What is actually happening? We're covering up our peace. So, yeah, I totally agree with you guys. Yep, we cover up our peace, and it does not help us. Yes. Yep, I like it. So everything that we do, we have to make sure that it has a benefit. The things that we think about, the things that we entertain, how does it affect us? Is it taking us further away from our peace? Is it taking us further away from our peace? Okay. All right. So this is a visualization. All right. So just a reflection of that activity. These are just questions here. It said at the bottom of the page, it says, when you shaded the clouds, were you able to identify the peacefulness that they represented? Were you able to identify the peacefulness that they represented? Did you guys identify maybe coloring as something that you could do to help you de-stress? Or did it help you to write down all of the things that stressed you at the moment? Write it down and see it. Okay. And then also another reflection question for your own self is, what is it like? What was it like for you to cover up? What was it like for you to cover up your peaceful clouds with the stressors? What was that like for you? What was that like for you? I know the first time that I did this activity, when I saw what I had done and what I do to myself, I was so frustrated and I didn't want to do it. I didn't even want to write down, these stressors on top of the clouds, because it was just coming to the realization that this is what I do to my own self. There's nobody involved in this process but me. And so I was hesitant to write over the clouds, and then I was frustrated. And then I said, okay, Regina, you have to stop being anxious about these certain things. You have to stop being anxious about these certain things. So let's talk a little bit more about test-taking anxiety. Yes, okay. So yes, on YouTube it says, yes, that coloring helps them to reduce stress. That's perfect. Okay, so test-taking anxiety, we're on page 7. We're on page 7, and we're filling out the blanks here. Here they go. Test-taking anxiety is situational. Test-taking anxiety is situational, and it usually comes before, during, or after a test. Okay, so if you're experiencing anxiety about NCLEX, it should not be able to affect your other things in your life. So you are stressed about NCLEX, but you're able to interact with your children, and you're able to pay all your bills and have conversations. All right. So some of you guys, I know that you deal with anxiety about this, but it is actually normal. Here are some symptoms of test-taking anxiety. They are upset stomach, just like the picture that we drew. Anxiety as a whole and test-taking anxiety will present very similar. So you have upset stomach, you have sweating when you think about the exam, when you're studying for the exam, your heart is racing, you have trouble following simple instructions. Yes, it also, you blank out when it's time to answer questions, when you have test-taking anxiety, and you become emotionally unstable. So you cry easily, you get impatient, you snap out on people. And this happens when you're in a lot of stress, And this is what you see with test-taking anxiety. There are 3 types of students who suffer from test-taking anxiety. And this is what I experienced getting emails from you guys. So the 3 types of students who experience test-taking anxiety are, number 1, students who do not study for the exam. You really didn't study. You wanted to, but things just came up, and so you didn't study. All right. Students who studied but didn't study in the right way. And I have right way here as in parentheses, because the right way is different for everybody. There are some generalizations that help you to do better on tests, but everybody has a learning style and a learning preference. And so sometimes when we study for an exam, we study based off of what somebody else did, or what our teachers told us to do, or, just what the popular thing is right now. And it doesn't benefit us, because although we may have put in hours and hours of studying, it wasn't the right way. So we didn't retain much. We didn't become competent. We memorized a lot, but we couldn't critically think to put it together. So studying the right way will cause you to decrease the anxiety associated with an exam. So I'll discuss a little bit more about that. The third type of student who experiences test anxiety will be that student who studied the right way, but allowed anxiety to interfere with their performance. Oh, and that's so frustrating. That is so frustrating. When you studied and you sacrificed and you put in the time, but when you get in front of that exam, you let your anxiety overcome you. And you send me emails and say, I know that I knew those questions, but I just picked the wrong answer, Regina. I just picked the wrong answer. I didn't think, I misread it. And so that is the most challenging situation, because as an instructor, there's nothing you can do or say when the person did everything the right way. You studied like how you were supposed to study. You knew the information, but you let anxiety overtake you. And so what our goal is here today is, when you recognize those symptoms of anxiety, you can stop them. In your mind, you can think about it a different way, okay? Think about it a different way. Yeah, anxiety will cause you to misread, will cause you to give the wrong answer to the question, and it really, really affects you. So just being able to identify yourself as that type of student, or whatever type of student you are, is a big breakthrough, because you know what you need to work on, right? Yeah. And I do agree. I do think that when it comes to NCLEX and nursing exams, that a different format should be considered. Because there are different learners. Standardized testing is very, very, what's the word? Standardized testing is catered to a specific type of student. And I don't think alternative learning styles, people who are oral or audio learners, fit best for the standardized testing, okay? So 3 types of students who experience test anxiety. Which one are you? All right. When you are preparing, this is filling in page 8. When you are preparing for an exam, I just want to caution you guys. When you're preparing for a big test, please avoid stimulants. And stimulants it's tough. I know stimulants are caffeine, sugar, and nicotine. And I know it's really tough, especially when coffee is like your thing. I know, I get it, but it really predisposes you to those anxiety feelings. Those are stimulants. So if you add on the stress of a test, you have a perfect combination for being overstimulated totally, maybe experiencing some sort of panic attack. So it doesn't help. Another thing that also I was listening to last night, which was interesting, and it said that gluten can cause your body to stress out, which was weird. Like breads and things that have wheat in them can also do that. So just like there's foods that predispose you to diabetes and predispose you to high cholesterol, there are also things that we put in our body that help us to lean towards being anxious during a big exam. So think about it. Now, you know what? There is a case study here. And so I want to go over this case study and just kind of look at a case of a person who has some anxiety. And this is kind of like a mini review, because I'm going to go over some anxiety medication just to think about it. So I'm going to read the case study if you guys don't have the paper, but here we go. We have a 30-year-old Caucasian female is admitted to the emergency department. She is having, what is she having? She's having difficulty breathing. She also admits to chest pain and tightness, dizziness, palpitations, nausea, and feeling of impending doom. What does this sound like to you guys? She is unable to think clearly. She tells the nurse, I don't think I'm going to make it. I am having a heart attack. She is diaphoretic. She is diaphoretic and trembling. Her vital signs are 182 over 92. That's her blood pressure. 105 is her heart rate. Her respirations are 28, and her temp is going to be 98.4. The patient has no history of cardiac problems. No history of cardiac problems. So here we go. The physician orders 4 medications. The physician orders 4 medications for this patient. They are, 100 milligrams of diphenhydramine, IM, 2 milligrams of lorazepam, 10 milligrams of haloperidol, IM, or 3 milligrams of azopiclone. So which one is most appropriate for this patient at this time? Which one is most appropriate for this patient at this time? So I see answer A, diphenhydramine, which is also Benadryl. Okay, you guys know. And see some answers coming in. Okay, Facebook. The correct answer for this patient is going to be give her the anti-anxiety. She definitely needs that. And at this time, it's going to be the lorazepam, the Ativan. Yes, we need to give this patient Ativan because the number one function of that. What class of medication is lorazepam? Does anybody know? I know my Remar nurses know this. What class of medication is lorazepam? What's the group name for it? Where does it come from? Waiting for it. You guys remember? Yes, it's a benzo. It's a benzodiazepine, and they are great for anxiety. So anxiolytics, yes. So Ativan, lorazepam, diazepam. These are medications that will help with anxiety. Very good. Okay, case progress. So more information here. The patient reveals that she is going through a divorce and studying for her GMAT exam. Okay, the physician diagnoses her with situational anxiety. She fears that the anxiety will become chronic. She fears that situational anxiety will become chronic. The nurse, this is a question, the nurse should give the patient what information concerning situational anxiety? All right, and you got to write these choices down. Situational anxiety. A, it is a feeling that will go away on its own. It is a feeling that will go away on its own. B, it is a method of coping with current stress. C, it is a normal response to a stressful situation. Or D, it is an abnormal response to the GMAT exam. So here we go. What is the best information? What information concerning situational anxiety should the nurse give to this patient? A, it's a feeling that will go away on its own. B, a method of coping with current issues. C, a normal response to a stressful situation. Or D, an abnormal response to the GMAT exam. What should they say? And remember, when somebody is anxious, right? When somebody is anxious for NCLEX, you want to be what? You want to acknowledge their feelings and you want to be very therapeutic, right? Somebody's anxious, you want to let them know what? You want to be reassuring. So I see you guys fixing it. The correct answer, yes, the correct answer is going to be C. This, what she's going through, situational anxiety, is a normal response to a stressful situation. It's a normal response. So saying A, a lot of people picked A, and A, telling the patient that it's a feeling that will go away on its own is not very therapeutic. So if somebody is anxious and you tell them, oh, it'll go away, it'll take care of itself. So it's not as therapeutic as letting them know that what's happening is normal, that what they're going through, with everything that they're going through, it's normal for the body to produce these kind of symptoms. All right, let's move on. So here we go. The physician. Catch up, you guys. All right, here we go. The physician also prescribes the patient a long-acting anti-anxiety benzodiazepine. She asks why she should take the medication at night when morning is more convenient. What teaching would the nurse include in the education for this patient? So this patient, they're wondering, why is their medication being prescribed for nighttime? When morning they're awake, morning they're up. Why can't they take it? So here's the choices. A, if you take the medication in the morning, then you may have difficulty remaining awake at work. B, if you take the medication in the morning, you may have increased anxiety during the day. C, this schedule promotes sleep, and there is usually enough residual sedation to maintain anti-anxiety effects throughout the next day. Or D, this schedule is prescribed by the physician and therefore must be followed. I'm going to read that one more time for people who don't have it. She wants to know why she has to take it at night. A, if you take the medication in the morning, then you may have difficulty remaining awake at work. B, if you take the medication in the morning, you may have increased anxiety during the day. C, this schedule promotes sleep, and there is usually enough residual sedation to maintain anti-anxiety effects throughout the next day. Or D, this is the schedule prescribed by the physician and therefore must be followed. All right. I think we came to a consensus that in this situation, the correct, most therapeutic effect response is going to be C. You give this medication at night, it will help you sleep, okay, which people with anxiety have trouble sleeping, right? And then also it will maintain a sedation level throughout the day that is functional. Because remember, these medications, they can cause you to be sedated. All right. Last one, number 3 here. There were 2 choices that you had to write in, so you didn't have all the information, but here it is. Which activity would be the most appropriate activity for the nurse to participate in and recommend for a client who is extremely agitated? So which activity would the nurse be most appropriate to participate in for a client who is extremely agitated? So A, competitive sports. B, quiet bingo. C, daily self-guided trivial pursuit. Self-guided trivial pursuit. And then D is daily walks. Okay. All right. So A, competitive sports. Would you want to do this with a patient who is extremely agitated? B, quiet bingo. C, self-guided trivial pursuit. or D, daily walks, which is going to be best? There's two. People can get it down to two. Either I think C, self-guided trivial pursuit, or D, daily walks. One is better than the other, though. Which one? The correct answer, I like you. The correct answer is actually going to be D, daily walks. Why would the self-guided trivial pursuit not be the best? It is self-guided, which sounds pretty good because it's the patient, determining the trivial pursuit. Well, why isn't trivial pursuit the best for a patient who is extremely agitated? Some people like trivial pursuit, but what's the issue with it? You guys think? Not therapeutic. That's true. It's not therapeutic. Because it's not physical. I didn't understand. I like that point. I was thinking about for the nurse. Well, I was thinking about trivial pursuit being kind of competitive, like you're trying to win. And I think that's the same with bingo too. Like, what's quiet bingo? Is when you win, do you just say bingo really quietly? So they're all in the same vein of like competition. So like competitive sports, you're trying to win. And then bingo, you're like searching and you're hoping that your number's called, and that can make you more, that can make you more anxious. And then even trivial pursuit, that is like asking you questions about a certain topic. And do you know the answer or do you not know the answer? So it can cause anxiety, right? It can cause anxiety if you don't know the answer, if you do know the answer. So the daily walk, it is exercise for you to release some of those hormones. And it also is something that the nurse can do with the patient to build trust and to, be there for them without a competitive interaction. Okay. So cool. I'm so glad that we're putting that together. Like if you're anxious, you need to do something. You need to, release those chemicals, because that was a really big learning point for me. It was a really big learning point for me. And then I like Famata. She says, if it's self-guided and he's directing it, he can make himself more agitated. Yes, exactly. So the fresh air, I like that too. So what are some strategies here? Our last page, strategies to reduce test-taking anxiety. Let's fill in the blanks here. Strategies to reduce test-taking anxiety. The first one that I have here, slides are out of order. Okay. The first one that I have here is, I'm going to just make it solo, is study to master the content. Study to master the content. And when I say mastering a content, I'm talking about strategies to reduce test anxiety. Okay. When you study for an exam or a test, you master the information when you can teach it to somebody else. When you don't need to be prompted for the answer, but you can come up with the answer independently. And so that's how I like to teach you guys, so that you can repeat it and teach it to somebody else. And I like when you can teach it to somebody else who may not even be in the nursing field. That's how simple you can make it, because you understand it that way. And so studying for an exam is the same way, particularly with NCLEX. You don't have to know every detail. But large concepts you have to master. So if you're taking NCLEX RN, you have to know prioritization, the principles of prioritization, who you should see first. You have to know a lot of education. How do you teach your patients with diabetes? How do you teach your patients with, any chronic illness. Education is a huge point. Delegation, infection control. These are subjects that you have to master, and you have to be able to teach them to somebody else. And this is why, I always tell you guys to steer clear of just doing questions as a main focus of your review. It takes a lot of content to be able to master a topic. Just because you can answer certain questions on a subject does not mean that you comprehend it, okay? Because questions have a lot of prompts in them, and they give you a lot of hints in the question sometimes, okay? So the second thing, so the first one was study to master content. The second is develop a study schedule. Nothing like being consistent. Consistency is key to seeing progress. It's key to seeing progress. And your anxiety will decrease if you can see yourself making progress, because that's going to do? That's going to increase your confidence. And you have to have a certain level of confidence when you're going into this exam. So, one of the purposes of doing this particular workshop wasn't to be an NCLEX review. Like, that's not the goal. This workshop is for you to be able to look at situations that cause you anxiety, where they come from, and then how you can deal with them. Okay, this is totally separate. Already know NCLEX causes you anxiety. Okay, there are certain strategies that you can think about that may help you with your NCLEX in terms of how to pick the right answers and and all these other things concerning the questions. But some of you guys have anxiety that is totally unrelated to the actual exam. And that is what is interfering in your studying process. And that is what's making you not confident and afraid. And that fear is paralyzing you in the situation that you're in, and you have to move out of it. You have to move out of it. So this is for us to be able to understand anxiety more. And going back to my point, when you have a study schedule, when you have a system that you're following, it helps you. It really helps you to stay focused and not get carried away in the what ifs, okay? In the what ifs, or what the negative things that could happen, all right? The third thing that I want to remind you guys of is to get help. When you're studying for this exam, it is the best time to ask questions. Get help, all right? And particularly in areas that you're weak in. Everybody has different weak points. Some people are very strong in pharmacology, but not so strong in the reproductive system or the renal system. So you guys know your weak areas. Take the time to just be prepared and identify your weak areas before you take your exam. A big one is the day before your exam. Do not study. Please don't study. Honestly, if you don't know it the day before your exam, you just won't know it. You just won't know it. And you're going to go in there and you're going to do your very best. I don't think that you will learn something deep and profound 24 hours before the test. So let your mind work with what it knows. Because what happens when you study the day before the exam, you'll come across something and you'll say, oh my goodness, I didn't know that. And what will happen is you'll start to doubt what you have studied. And so when you take your exam, you may get into a point of second guessing yourself during the exam, which you absolutely don't want to do. When you take NCLEX, you go with your first mind. It is usually right. It is a natural response to what you've read. And so you pick and stick with that answer for your NCLEX exam. Even now, you guys know, go with your first mind. It's usually right. And then number 5, have somebody quiz you on the information, so you have to be able to explain it to them. All right, make a family member, your children, whatever, quiz you on the information. It is very important for you to do that. All right. People ask me all the time, how do I know when I'm ready to take NCLEX? How do I know when it's my time, when I should be ready? And my answer to that is when you studied for the exam and you have studied as much as you could, you have a feeling that we call saturation. And it literally feels like I cannot do another NCLEX question. I cannot study anything else. Like you are so saturated with information and quizzes that you just feel like I can't do this anymore. I just want to take the test and get it over with. That is usually a perfect indication that you're ready. So you just come to a point where you're like, hey, I've done all the content I need to do. I have answered all the questions that I wanted to answer, that I set out to answer. I've met my goals. I am full of NCLEX information and I just need to get it out. I need to get this over with. When you have that feeling, you go into the exam more confident. If you don't feel saturated and you feel like, oh, I wish I could have just 2 more weeks to do some more questions, change your test date. Just change it. Just change it. It is the best thing you can do for yourself. Give yourself more time to prepare. That's what you need to do. Give yourself more time to prepare. And yes, that is what you should be going for. That is what you should be feeling. So people also ask me another question that I wanted to address is, when should I schedule my exam? And here's my recommendation. If you're preparing for NCLEX and you have my program, usually it's a 6 to 8 week program. So I say 6 weeks of studying content, doing homework, doing research, emailing me back and forth, and then you do another 2 weeks of questions. So like the last 2 weeks, you should just be doing questions where you are just, rapid firing them, getting the answers in under a minute, and just getting into the habit of answering questions. I don't care how many you do a day. It doesn't matter to me if you do 100 or 500. What matters to me is that you have been doing them, okay? Because they will help you identify topics that you need to go back over. So that is my recommendation. 6 weeks of studying. And if you've been out of school for a little bit longer than normal, you've been out of school a couple years, or you have, you haven't been trained at the best nursing school. You guys know how your nursing school was and the things that they did or did not show you. It may take you a little bit longer, but take the time, because it's a lot cheaper to take the exam one time than to have to retake it because you don't pass it. All right. And I think if you're talking about changing your test date, like if you have it scheduled and you want to change it, I would say to not change it more than twice. Okay. Because I don't want you guys to get in a pattern of just extending it out. No, change it one time, see how you feel. Okay. You feel like you need another 2 more weeks, change it then, but then commit to taking it. And you don't have to let anybody know that you're taking your exam. Absolutely do not share it with anybody. Don't tell people even what you're doing, because that also brings on unnecessary stress with people asking you all the time, have you taken NCLEX? Did you pass it yet? Don't even get into that conversation with people. Make this a personal thing, because at the end of the day, you're going to have to go into that exam alone. All right. So just tell people who you know will be supportive and encouraging to you. Now, so this is things you can do before the exam. During the exam, I would definitely tell you guys to, of course, eat a good breakfast. When you go in that exam, you are prepared to be in there. If you're RN, 6 hours. 6 hours. If you're a PN, 5 hours. All right. You're in there for the duration. So yes, you can, take a break and, get snacks, but be prepared mentally for the long haul. And if you get a good breakfast, then you'll be able to do that. And that's another thing. When we're anxious and when we're stressed, we don't eat. And then we're in there and our blood sugar is low and we're hungry. We can't think. So you got to eat a good breakfast. On the paper that they give you, not the paper, on the board that you get, don't be afraid to write notes, because sometimes writing things down will help to stimulate your memory. It will help to stimulate your memory, and you will be able to remember some good things. And I do have a testimonial that I'm going to share with you guys at the end that I think is just amazing. But let me tell you guys some more of this. All right. Don't be afraid to take a break when you need to during the exam. It is okay for you to take a break. I have people go in the bathroom and pray and come back out. If you're taking a break, need to take a break and go in the bathroom, splash some cold water on yourself and tell yourself you're not leaving here without the license. Slap yourself in the face, whatever you have to do to get back in there and get your license. All right. Those are things you can do. Now, once the test is over with, please, 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 please forget it. Don't be at home trying to recreate the exam, remembering every question. That is futile. There's nothing you can do about it. You didn't pay for the quick results. You have to wait it out. There's no sense in you stressing. Enjoy your life. Whatever is done, okay? I would say yes. Take all of your medications. Take all of your medications that you're supposed to take. Eat correctly. Do everything that you would do on a normal day. All right? Remember, on your NCLEX date, this is a date that you wanted it to be. It is not a surprise when it's time for your NCLEX exam to come up. You're ready for it. You picked it. You want this to happen. You want to take this test. This is an opportunity for you to change your life. This is what you've been waiting for. The whole nursing school experience has been for that one moment. It's been for that one moment. So don't encourage anxiety by reliving that test once it's over. All right? Because it's over. You did it. Be congratulating yourself. And then the last thing, you guys, when you're thinking about anxiety, and maybe you're even in the exam, I don't know, but wherever you are, don't make it, relaxing is not something you force yourself to do. You can't force yourself to relax. You just have to acknowledge the fact that you are in a position to relax. Does that make sense? Like, you have the ability to relax. Those clouds, they're already there. The peace that you have, it's already there. We just need to erase all of the things. Erase all of the things that were causing it. I like that graphic there. All of the things that were over your clouds, let's erase them. And physically, our body will respond the right way, because that's what it is meant to do. Our bodies are living organs. They're living. It's a living being. So it adapts to whatever situation you put it in. Your body is there for you. So a lot of our bodies have adapted to not getting enough water because we don't drink enough water. So the body's like, hey, I have to function under these conditions, right? A lot of our bodies have adapted to, only being filled with junk food because that's what we like to feed it. So the body's like, okay, I have to work in this environment. And it's the same through with anxiety. When we're constantly under stress, our bodies will adapt to it, but we will see health effects. One of the things that you guys have in your package is one of my favorite documents, and I send it out a lot. It is the NCLEX grief form and mental preparedness form for nursing students. This form is super beneficial because it takes you through a series of questions that help you to identify where you are in the studying process or the healing process, or, how did your last situation of studying go? What could be a root cause of you failing, or things that you can work on, So, like, for example, it's 2 pages long, but one of the questions that I really like here is, what do you feel you need to move forward? And also, what are your strengths when it comes to learning? Because I think those are things that we're not usually asked. Nobody really asks us that. And also, what are your strengths when it comes to overcoming adversity, because you certainly will have that during your studying. So this is very introspective. You guys, you can email me, Facebook me, and I can give you guys this form. I'll send it out to you, and you can do it. All right, you can do it. I want to congratulate just some nurses that we have here who have passed their NCLEX exam. All right, just give a quick shout out because I know that these inspire you guys and motivate you guys. So the first one is Kalari Wallace. She just said to me just an hour ago, Regina, I passed. My video is coming soon. But sister, I could not have done it without the Lord. Remar, review, you, Mark, and the prayers and encouragement. Sis, I passed NCLEX. I am a Remar nurse RN. I never thought that I would be saying it. I passed NCLEX. So can you all? Remar is that deal, content over everything. So this is a wonderful testimonial. You see him on the Facebook page. Jamin, Faye S. Hampton. She's on here right now. She gave me, we all watched it today in our meeting. She gave me like the best video testimonial of her journey. I mean, get on Facebook and read and listen to this testimonial. Like, it is so compelling when you hear her story, man. I love it. She international nurse from the Philippines, just took the NCLEX. And the thing about, she had to take the NCLEX LPN when she came over. And then she, then she went back and took the RN. She just did questions. She'll tell you. She just did questions and she didn't make it. She got all 265 questions. Her first time taking the NCLEX RN, she didn't make it. And then she, started studying the content. And she got the Remar information. She did everything. I think she listed everything. She got quick facts. She got the question bank. Then she said she did the blog. Then she did the free trial. I forget how many resources I have out there for you guys. She did the free trial. Then she got the DVD package, at the end of it. And she passed her NCLEX RN exam. Let me read this to you guys. She says, a month ago, I wrote this review for Remar. She wrote a review before she passed. And glory to God for the victory. He blessed me. On June 13th, I took and passed NCLEX RN. Truly, I was restored by the marvelous Lord Jesus to be able to share this wonderful testimonial with you all. Let me read what she wrote for her. And I hope this encourages you guys. My goodness, it says, Remar stands for restored by the marvelous God by faith. Amen. Thank you for making a content review that is easy to understand and retain. I first got the quick facts in February, and after 2 months of going through it and getting myself together, because I failed my first attempt in NCLEX RN last year, I thank God for providing and was able to get the DVD package. All right. How amazing God works, and very timely too, for the Facebook Live Remar Nurse University. Were you guys there for Remar Nurse University? Amazing. She was there. She says, thank you as well for putting up Remar blog. I went through all of it my first weeks after I found you. So Remar blog is www.remarblog.com. And it's a little something that I started back in the day that I think will be very beneficial. And we left it up because there was so much good information on that blog. So she says, I went through all of it on my first weeks after I found you. Also, the YouTube videos are amazing, and the Trial Online Academy. I did sign up for the boot camp even before I got the DVD, so now it's like a reinforcement. Thank you, Regina and Mark, for doing the journey with a powerful prayer. It gives encouragement and keeps our hope and trust in our Lord Jesus that we will pass NCLEX. God bless you more. Glory to God for the victory and the victories on the way. She says, California, LVN 2017, USRN soon. She wrote that in May. She tested this month, June 13th. She said June 13th, and she has her USRN. And let me tell you, her testimonial can literally have you in tears because you feel that struggle, you feel that grind, the obstacles that she had to overcome, getting her citizenship, having to take the LPN, then studying and having to take the RN. I mean, that is to God be the glory, because some things you think about that you've been through, you did not have the strength to get through that on your own. And I love her video. You will be seeing that a lot on our page to motivate and inspire you guys who are in the same situation, or who sometimes we think we have issues, we think we have troubles, and then we hear somebody else's testimonial and it's like, man, no, if she could do it, I definitely can get through what I've been going through. So thank you guys so much for the community that we have here. We talked about anxiety and how to deal with it today. That's what Remar nurses are about. Yes, she was, her testimonial is amazing. But that's what we're all about. We're waiting to hear your testimonial to inspire and encourage and motivate each other. I mean, literally thousands, 10,000s and thousands of nurses are inspired and read and take in the comments. I get emails that say, I read such and such testimonial and it really spoke to me, or she told me this, can you clarify it? And it's just like a community of information and knowledge, and that's what we're about here. So thank you so much for doing this anxiety workshop, taking time out of your schedule to hang out with me and, the Remar family. It really means a lot. It really means a lot to myself and Mark and the entire Remar team. We work extremely hard to make sure that you guys are, well-informed, you're motivated, you're encouraging. We want you guys to have success. We value it. We value you guys as individuals. So anxiety will be a thing that you will understand much more, and you will be able to erase all those stressors because you understand the purpose of anxiety, the benefits of it, but also how temporary it is when you are moving forward towards your goals of being a nurse, So thank you, everyone, to everybody that's testing this week and this month. We are praying for you. Our hearts are with you as you study. We're here. You guys can always email us at support@remarreview.com. I love your NCLEX questions. You guys have when you're studying the program, you have questions about the program, please email me. I want to make it plain for you. Hey, somebody's all right. I hear you. Somebody's requesting prayer from the elder. So I'm going to ask him to come in to pray. We're going to pray that he comes in to pray. Yes, we are moving forward to fight the battle. We'll just have him come in if he's here. Yeah, but we have worked really hard to put this presentation together for you guys, and we thank you so much for all the positive comments. Tell somebody, share a video. You guys know how important being able to deal with anxiety is in the nursing community. I have not ever seen this subject being spoken about. I have not ever seen a workshop on this for NCLEX. So I want this to get out there. I want this to get out there, and I want students to know that this is a real thing, and this is a resource that is available for them. So get the workbook, fill it out. If you didn't get a chance to fill it out, keep it, go back over it, share it with somebody else. Do the activity. Do the activity with the spouse too, with the spouse or a family member or even your kids, because I think sometimes when you see something, when you just see something in like black and white, and you see what it can be done, what it does to you or what it looks like, it makes a world of difference. So I'm thinking about doing this with my daughter. She's only 4, but it's never too early. Too early. So, okay, perfect. Thank you. I see Mark coming in. He was like scrambling, and I was wondering what he was scrambling for. I don't know why I thought it was. I don't know why I thought it was something that it wasn't.
Something that it wasn't. It must have been anxiety.
Yeah, I know, right?
The imaginary, right?
Yeah, it's the imagined stress. But somebody asked you to pray.
Okay.
So I guess we're praying for, what are we praying for? We're praying to be able to overcome, Monica, we're praying, thank you. We're being able to overcome our anxiety. We have exams coming up. We have big decisions that we have to make in life. And we're just asking for prayer for those things. Anything else? Did I miss anything else? You like your glasses. Turn anxiety into strength.
Love it.
Yeah.
I love it.
Yeah, so that's what we're praying for.
All right. So thank you once again for joining Regina and I for the test anxiety workshop. Yes. Be anxious for nothing. Regina was telling me some of the reasoning behind doing the workshop, and also some of her, past stressors and things like that, where she's come from and the things that she's dealt with. And it's really amazing and so real. And so that, she's really a testimony in that sense to go from, somebody that, had a lot of stress and anxiety so that you could feel it in a palpable way, to being able to teach and demonstrate, what God has done for her and ways to cope with anxiety and ways that you can do those things as well. So the title of the workshop is Be Anxious for Nothing. And most of you know that comes directly from the Bible, from the scripture, from the book of Philippians, and it's found in chapter 4. So as I was scrambling, I'm like, yo, where is my Bible? Where is the book here at the office? Because I wasn't expecting this, but it's in the book, so we can look at it really quickly. So I'm going to give you the verse. It's Philippians chapter 4. I'm going to begin with verse 4 and just give you what the word says about being anxious or being careful and how to overcome those things. So it says, rejoice in the Lord always. Again, I say rejoice. Let your moderation be known. Let your moderation be known unto all men. The Lord is at hand. Be careful for nothing. That's the word right there. Be careful for nothing. That's also translated as being anxious for nothing. So it starts off with rejoicing before the Lord, letting your moderation be known before men. And it says, be careful for nothing, but in everything, by prayer and supplication with thanksgiving, let your requests be made known unto God. All right. So be careful for nothing, be anxious for nothing, but with everything, with prayer, supplication, with thanksgiving. And I just want to focus on the thanksgiving for a second, because we have so much to be thankful for. There's a lot to worry about, and we wrote all those things on top of the clouds. But I mean, we have more to be thankful for than we have to be worried about. And especially, it says, let your requests be made known before God. So when you can do that, when you can let God know the troubles of your heart, the things that you're concerned about, the things that you're worried about, then you have a decision to make. You can say, okay, is my God bigger than my problems? Is God bigger than my problems? And of course, the one that created you is greater, is the greatest, is the most high. And so he's certainly greater than all of the problems that you can ever write on any piece of paper.
Amen.
Right?
Amen.
And so with that, be thankful for the things that you have. Let your requests be made known. And God is bigger than all of your issues. All right. So thank you once again for joining us. We're going to close this in prayer. And we want you to do the same and embrace the same attitude of prayer as well. We love praying with you. We love praying for you. Yes. We want to encourage you all to do the same for each other. All right. So let's pray.
Okay.
All right. Father in heaven, thank you once again for allowing us to be able to, first of all, just come to you. Thank you for giving us your love and just your attention, so that you would be even concerned about the little things that we have worried about. When we look into your creation, we see that the birds have a home. We see that the flowers, they grow. And we also should see and understand, Lord, that because you take care of nature, because you take care of everyone around us, that you will also take care of us as well. Help us to have that reliance and dependence upon you. Lord, when anxiety comes, help us to recognize that it's a normal thing. It happens, but also help us to, that it can help us to draw us closer to you. So there's a fight or flight response, Lord. Help our response to always be to fly into your arms of safety, so that we will have the peace that goes beyond all understanding. When things seem to be completely out of control, we know, Lord, that is a false reality, because you are in control. So I ask, Lord, that you would be with the individuals, the students that are testing. I ask that they would be able to put in the diligence, the study time, that they would be able to make the proper preparation, and that they would be able to honor the work and the commitment that they have chosen in the field of nursing, or whatever field they find themselves testing in, Lord. I ask that they would be able to honor that obligation and that commitment, and that you would bless them in that process, even when they do not deserve it, Lord, because we don't deserve anything. It all comes from your grace and your mercy. This is our prayer, Lord, that you would calm their minds and still their hearts. In Jesus' name we pray. Amen.
Amen. Thank you, Mark. Thank you so much. Thank you guys for being with us. This was a wonderful workshop. It was the first time that I've ever done this topic. So thank you guys so much for being here with us. Please continue to study with us here at Remar Review. You can link up with us on our Facebook page, YouTube. We have the website, remarreview.com. We are available here when you're ready to study. We love studying with you guys. We love you guys so much. Thank you for being a part of our family. Have a good day. Bye-bye. Hey, YouTube, thank you so much for joining me. You guys are awesome. I saw the comments. I try to get to everybody as much as I can, but I hope you loved this anxiety workshop. Your answers were right on time, and the encouragement you gave each other was very, very Remar-like. So thank you so much, and I hope you guys have a wonderful rest of your day. Bye-bye.